As a dentist, I went to dental school to help my patients, and that was actually the main motive for me to do that. And that's where most dentists actually end up going to dental school. But what really happens, though, is there's a lot of dentists that do not understand that a lot of patients actually had a major barrier to be connecting with us, which is actually fear of the dentist itself. This is one of the major barriers, and it took me actually personally 10 years to realize that myself, that patients hate the dentist. Patient does not like coming to the dentist. And that actually turned my life around. First few years was rewarding for me as a dentist helping patients, but my main actually personal reward started to get to a higher level when I realized this major barrier to our patients and how anxious patients react to the dentist. And it came by adding a lot of value. At the end of the day, if I go home and I feel like, oh, I was able to help this person overcome their fears so they can enjoy it itself, so they can actually be able to go socialize and eat and enjoy their smiles. Removing that barrier and helping a patient get to the next level was a major personal reward for me. And that's why at Signature Smiles, we always focus on helping patients removing this barrier, which is being scared, having anxiety, being phobic about coming to the dental office. So the big question is, what is fear? Let's start with generally speaking to realize that as a patient, what does fear mean to you? Generally speaking, fear is a very good thing. When we are kids, getting out of danger, or even teaching our own kids, not to touch the fire, how to cross the street, that is actually a very basic instinct that our body to help us so we can protect our well-being. So the problem with fear itself is when actually acquiring a certain types of fear that actually will be against our well-being instead of being pro well-being. For example, my wife is scared of cats. She can still survive, live her life, normal life, without being any problems with that. But if you have a dental fear and that actually it's working against your well-being, and now it starts affecting your social life, your habits, your even smiling, your confidence, your deeper level of social life, that is basically functioning against your well-being, and that's where we start having an issue with that type of fear. So what is the differences between fear, anxiety, and phobia? Fear is basically an emotional response to a threat or a perceived danger. Anxiety is almost the same, but the main difference is not immediate threat. For example, I have fear of the dentist. No problem, I live in my life. I have a dental appointment. I show up to the office. Then once I see the dentist or once I am in the dental office, that's where my emotions start moving. That is fear. Anxiety is actually non-immediate. That means I booked an appointment 2 weeks, and now I'm actually starting to have emotional response to even before getting to the dental office. That's really what's the difference between anxiety. It's the anticipation of the threat and danger way ahead of the game, instead of having it in front of you and have an immediate reaction to that. A phobia is a completely different level where it's actually get to a certain level of anxiety and fear that it will start impacting your social life. So it's not just, oh, I'm scared of the dentist and I skip seeing the dentist. No, I'm scared of the dentist. I have major pain. I am so ashamed of my smile that I will not date anybody, but still I'm so phobic to even show up or call the dental office. So that's really when we start thinking this is a phobia, not just a simple fear or anxiety, is when it's having a major impact in somebody's life and they cannot even act on it for seeking help. Dental fear, dental anxiety, and dental phobia are a little bit different, but they share one thing, is the emotional response. And the emotional response comes in three things. It comes in our cognitive mode of reaction, it comes in our physiology as well, and it comes also in our clear behavioral change. So for example, I'm sitting in the waiting room of a dental office, I start cognitive, I'm thinking in my brain, I was like, oh my God, something bad is gonna happen to me. So there's something going on in our head. Is just we're very close to a major danger. So that's our first component. The second component is more about a physiology, something we cannot control. Think about it, you have a major threat coming at you. What's going to happen? There's something called in our system as a sympathetic system, which basically your heart rate is going crazy. You're sweating, you have your GI, your stomach is getting upset over there. You really start sweating. This is something beyond your control. It's just a system, to protect you out of danger. And the third one is something clear, behavior. And you're sitting very tense, you're shaking, you're actually started to get more mean, even acting sometimes stupid. You get scared of something and you're willing to cross the street, although there could be a car that can hit you for that, because that's just, you're so scared, your muscles are tense, and you start showing outcome. These three components is what we mean when we say emotional response to being scared of the dentist, to being, anxious of the dentist, or being phobic to the dentist. Scared of the dentist, have fear of the dentist. Everybody around you say, grow up, is just a dental visit, it's just a cleaning. Who should really truly decide whether you have, you're scared of the dentist or not? Is it really the threat itself? Like, for example, my wife is scared of cats. Is it really true that I just should say, hey, it's just a cat, grow up? Or is it really her personal experience or her own perception of that threat? That's really where fear and anxiety should be defined. It's not an outsider who's telling you should not be scared of this and you should be scared of this. It is actually your own perception based on your previous experiences that actually change your interpretation to the situation. So coming to the dentist should be, in the normal life, a simple visit, come get a cleaning done. But a lot of your own experience grow you to a position where you have your own perception. This is a danger to me. And the reason why that is extremely important is not to feel judged. And this is a right that you had to know, that you own, that, hey, nobody can judge me based on my own perception. I need help on that, and I need to speak up about it so I can get the help of it. How do people who are scared of the dentist, react? Why do they behave differently? A person with dental anxiety is just a normal person. They run a normal life outside of the dental office. But the second they get to the dental office, that's where the inside conflict starts. They understand that they need to take care of their teeth. They understand that teeth are extremely important to chew, function, smile, and be happy. The problem is the tendency of, avoiding the dentist, or they perceive the dentist or the procedure or the pain that comes with that as a major threat. And that's where really they're avoiding it. So more education about the importance of how, taking care of your teeth doesn't really help with the conflict. It's really lowering the barrier is more important. That is extremely important to know for both the dentist and the patient, and to help each other with this conflict. We came in the last 50 years to a lot of education that most people in this country understand the importance of taking care of their dental health, brushing, flossing, visiting the dentist every few months so they can keep their teeth till age 95. The issue, though, when we come to anxious patients, it's not the knowledge, it's not the level of knowledge they have or what they do at home. The issue is an internal conflict between they are identifying being scared of the dentist as a major threat to them, so they will not seek help from the person who's there to help them. That internal conflict caused the issue, and which could cause problems to accumulate, get bigger, and end up putting them in a very sinkhole that could cause more issues, affect their social life, and it's just getting worse and worse with that internal conflict. And if we don't realize that as dentists and patients and don't work together as a team on this, it usually gets worse. So that conflict that goes inside every patient, it comes from two things. They understand the importance of the teeth and maintaining it, and how important it is to go out and socialize with people and eat and function. And at the same time, the avoidance, tendency to, I'm scared of the dentist. And based on which one is bigger, we see usually four types of patients. Number one is, a lot of people are what we call the apprehensive patient. And there is another level of patient, we call them goers but haters. And the third one is who really partial avoiders. They try to avoid the dentist, but they still show up. And finally is what we call the total avoiders, or the ER patients. And we will talk in a minute what's the difference, the details difference, but they mainly have the two major emotions. I had to take care of my teeth. I understand the importance of my teeth. I want to really go to see the dentist and fix my teeth, but their avoidance factor, it's really what decide how much they hate the dentist or the procedure or the pain, and whatever wins put them on each category. So the apprehensive patient, most of people are actually apprehensive people. We're talking about 70% of the people have this tendency of they don't like the dentist. They had a previous experience with the dentist, or when they were kids, they saw, their mom or dad going through, a bad experience, but that did not prevent them to come to the dentist. That didn't give them a trauma enough. So they're still very apprehensive. They actually show up to the dental office, they commit to their appointments, they actually will take care of their teeth. And they are best at masking that fear. They are worried that somebody's gonna say, "Oh, come on, grow up," So they don't want to be childish. They don't want to be perceived as childish. So the dentist most of the time does not realize that this person in front of me is actually, having some fear against the dentist. You actually, as a patient, may be in that category and you don't realize it because I see the dentist, so I'm fine. Usually you say, "Oh, I hope this will be quick," or "I hope you don't find any cavities," or I hope this will not hurt. You just say these statements. As I mentioned, 70% of people are this group where they actually mask their fear. They can still show up to their appointments. Their fear or anxiety will not prevent them from getting dentistry done and maintaining their teeth for the rest of their life. But the problem is the dentist does not realize they have these fears. And any bad experience or painful injection or being judged by the dentist by a word here or there could actually get them to the second category and actually increase their fear. And usually they don't come back to that dentist. They try to find another dentist who can see them, but that's where most people stand. The next group of patients, what we call goers but haters. These are the people who truly hate the dentist, but still they want to go get their teeth taken care of, and their fear is not enough to prevent them from doing that. So they still show up. They will never mask their fear. They will tell the dentist face to face and say, "I hate the dentist." And these patients usually are more, for the dentist perspective, they are more trouble because they had to take frequent breaks, they had to stop the dentist all the time, which actually increased stress to the dentist as well. And now both the dentist and the patient are hating each other. And that is a very interesting group, I would say, but at least they are committed to their appointments, at least they are committed to their health. And the other major thing about this group, the goers and haters, is you schedule an appointment, you're gonna show up to the appointment, but you actually start worrying, about it a few days in advance. So you schedule next Thursday, still there's another week in showing up over there, and you start every night you're thinking about it. You're still committed, you're still gonna show up. That's what makes this group unique, as they hate the dentist, but they're still showing up. But any minor trauma could actually make them go to the next group. So the third group is what we call a partial avoider. These what we call the friends of the dental office. That means they are not willing to commit to a routine dental care. They're not willing to come and see the dentist all the time. They will never keep their appointments. But when the pain get to the point, or there is a family pressure get to the point beyond their fear and they had to be seen, they will show up, get that fixed. For example, you're fine, you're avoiding the dentist for 5-10 years, extreme pain, keep you up at night. That will help you go, to the dentist, overcome that little fear, get the work done, get out of pain, and actually completely go back forgetting about the dentist. You have a wedding coming up, wife will drag you to the office and say, "No, you had to see the dentist now." It's usually we see family pressure coming to play to help this person come and overcome that type of fear. These patients are great. It's very hard to keep them, and we will talk later how we can reverse as much as possible with, their fears, so they can get the more frequent visitors to the dentist, so they actually can maintain their teeth for a long time. Avoiding the dentist for a few years, it's only do one thing, unfortunately. It just increases the problems that you have. If you have a small cavity, it's just gonna get bigger. If you have gum disease, it's gonna get worse. So that's why we always try to get them in a good position where we treat them based on when they show up for the pain or the family pressure, and hopefully we can get them back on track so we can try to resolve the issue before it gets to the point that it's irreversible. We cannot recover from it except unless we do a major procedure. The last group of patients are what we call total avoiders, or I personally call them the ER patients. These people will do anything under their power so they do not see a dentist. They are willing to go to the emergency room, urgent care places, get some antibiotic to buy time. They are willing to self-medicate. They are willing to use alcohol, drugs. They will actually, the only time they show up in the dental office is it could be under influence. And just to be able to overcome, that's what we call a real phobia from the dentist or the dental procedure. These patients, I remember there was one patient showed up one time, 27 years. His wife literally dragged him. He'd been for 27 years going to the emergency room, and he said, "Listen, doc, I had one shot, one chance. You can do it today. I will never come back to you." Literally, we were able to sedate, help this patient. Never seen him again. He was happy. I could tell you the next day he showed up one time outside the office and said, "Doc, thank you for helping." And he will not even step a foot in the office again. And that was the last time I seen him. This is what a true dental phobia is. And most people, if you're thinking if you are this person or not, the easy test, most people think this way. Please put me to sleep under general anesthesia, take all of my teeth out. Even if they were good, I just be done with this. I don't want to see a dentist in my life. That's the true phobia. And we see a good amount of patients or people who need help in this category. And that's where it starts impacting their life, as I mentioned. When you have such phobia, most people in this category, they can survive the first 20, 15 years, but their teeth get to a position where they're so ashamed of their smile, they cannot chew. They would rather eat mashed potato all the time and just give up their steak or their social events rather than seeing the dentist. And these ER patients, they are actually willing to tolerate extreme high level of pain, swelling, problems, dental problems. That's actually way beyond any painful dental procedure would cause even, but they are not willing to face the threat, which is basically they perceive it as the dentist. Does education help with overcoming anxiety and fear? It does to a certain level. Education about the anxiety itself and how to handle it, breathing techniques, what we can do to help with the anxiety will help. But education about the benefits of taking care of your teeth or the dental care, usually most people had that basic knowledge and it will not help. And unfortunately, most dentists, that's their approach, is if I talk more why you need this treatment, this person will overcome. So they are actually they're trying to solve an emotional problem with reasoning situation, which doesn't work. It's an emotional problem. You have fear, you're scared, and trying to reason a patient through it could actually buy more problems, because if the dentist were able to convince this patient through that to take another dive into it and it caused any minor problem, any minor fear or any minor pain or any minor discomfort, could actually skyrocket the level of anxiety and move a person from being just a little bit apprehensive or maybe a little anxiety to a way higher problem. So reasoning is important as part of education to the patient. Everybody deserves to know why they're doing the procedure, but it does not really come handy, or it should not be used as a tool to treat anxiety itself. a lot of people and dentists themselves, they underestimate the number of patients who are terrified of the dentist or have some level of anxiety toward the dentist. Research has shown that around 70% have some level of anxiety to the dentist. There is actually 45% of people are willing to cancel or put off their dental appointments because of the dental fear. And as we mentioned, there is 10% to 15% that they're not even willing to come to the dentist. You could actually easily see that in the culture and how the dentist is being related to being scared. You watch movies, comedy shows that always relate the dentist to the fear, which actually created in our subconscious mind that there is always a link between the dentist and being scared or some level of anxiety. So what is the anxiety sinkhole? Generally speaking, visiting the dentist, could have, when you were a kid, or even when you're just seeing a dentist who is not really worried much about your anxiety levels, you may have small incidents, and these small incidents adds up. You can have a painful injection. You may be able to have not enough Novocaine. A lot of patients say, they did the procedure on me, not enough Novocaine. I was not completely numb. I was able to feel it through the whole, to feel the pain through the whole procedure. A lot of patients, they say, the dentist never stop when I raise my hand. They told me to raise my hand and they just never stop. They just continue going. It's also being judged by the dentist. I open my mouth, they laugh, or they say, why you don't take care of your teeth? All of these events, they adds up and they can get you to a position where you start evolving your dental anxiety and having fear of the dentist. And it doesn't happen quick. It takes time. And generally speaking, it starts with skipping dental appointments. That means you start having a small, painful injection. So the next appointment, you're like, let me just skip that. So you start skipping the dental visits. The problem with that is the situation of your teeth and gums get worse. And you realize that as a person. It's like, I know when I brush my teeth bleeds. I could see a cavity here. It hurts sometimes and hot and cold. So you understand that it's getting worse, but what's happening is your anxiety starts going higher because you remember the bad situation that happened. And now that increased anxiety is making you skipping more visits, ending up in a bigger and bigger problem, and where that will put you actually into still avoiding the dentist and getting you to a position buying more years. By the time you feel into, by the time you go into all of this cycle, it's already 3, 4, 5 years. You don't even realize how many years already passed since your last visit. That's then start getting to the point where it start affecting your social life. Oh, you know what? I can't eat here, let me eat here. Then you can't chew food. Then you actually more worried about your smile. You start putting your hands up. That's what we call is getting you into more and more social problems. And with all of that, you're not realizing in subconscious mind that your anxiety is now getting deeper and deeper. So you're really digging yourself. You're trying to avoid the dentist, to avoid a simple procedure that was painful, but now you're digging yourself into a bigger hole. That's what we call the sinkhole. And all of that starts creeping into your low confidence level. It start affecting you. I cannot date this person. Oh my God, this person asked me for my phone number, but the second he saw my smile, he dropped. In that now affecting your social life and your low confidence level. Then that gets you to what we call the dental phobia. So dental phobia, although sometimes it can go from 0 to 100, but most of the time we see it happens over the years. And by avoiding the dentist, it started with a simple move, is skipping the dental visits, avoiding even having an honest and open conversation with your dentist. Hey doc, it was painful last time. Can you take it easier on me this time? And it just going through the years, and your anxiety level get to the point where it's 10 out of 10, and now we're stuck in the sinkhole. So every person is different, and behind every person is a unique story why they have an anxiety and dental fear. But generally speaking, there is 4 major categories why people are scared of the dentist. First group of people, they hate specific stimuli. Second group of people, they just don't trust the dentist. They don't trust the people at the dental office. They have a mistrust with that person. Third group is actually they feel vulnerable and loss of control when they go to the dental office. The fourth group is the fear of being embarrassed, belittled, and being judged by the dentist. So the first group of people who are scared of the dentist are, generally speaking, they are scared of specific stimuli. For example, a lot of people say, once I pass the needle, I'm good, doc. It's just I'm terrified of the needle. Some people, is the drill. The sound of the drill even brings bad memories to them. It doesn't need to be seeing the drill. It's just the sound. Doc, just hearing the sound of the drill in the next room is actually bringing bad memories, and that fear start, piling up. Some people, even the smell of a dental office. That's why it's extremely important to, as a dentist, to work on the smell of the office, because it could actually start the problem. It's extremely important as a patient to know what's your specific stimuli and to share it with your dentist if they don't ask. Generally speaking, the dentist should be the one who's trying to educate himself about why you're scared. But if that doesn't happen, you have to reach out and say, doc, I'm scared of the needle. I'm scared of the sound of the drill. So both of you can work together to overcome that specific stimuli. The second group of people are a person who does not trust the dentist, period. Have a bad experience. A dentist, told you it's not gonna hurt, and it did hurt. A dentist told you that if you want me to stop, raise your hand. He did not stop. He was not caring. He gave you a bad experience. There was some physical harassment even. We see that all the time. And if you're part of that group, it's not the needle that causes you pain. It is really the trust of the dentist. So you really, in that scenario, you had to look for a dentist who can have a great chairside manners. And more important too, is you want to start building relation with the staff around the dentist and ask the staff about the dentist himself. So that will help you actually building trust with the dentist himself. It is not easy, and we can talk later how we can overcome this trust. But that's a major group of people where their main fear comes from the trust itself. The third group of people of the fear of being embarrassed and the fear of being belittled or being judged. You go visit the dentist all the time, but one time he says, well, you don't take care of your teeth, or you smells bad, or open your mouth and the dentist laughs at me, when I open my mouth. And the anticipation of these comments are actually proven by research is more painful to the person than even a physical injection itself. The last group of people who have anxiety to the dentist comes from feeling vulnerable and lose control. Think about it. You walk to a place, you're getting seated on a chair, you had no idea what's going on around you. You're being put to the back, and you're in full, somebody you barely know is poking very close to your head, your mouth, your teeth. You probably, if you have that anxiety, you're already having your heart racing right now. And with all of that, you have zero control of the whole situation. You cannot escape it. You don't know what to do. Should you trust this person or not? Close to your face. That is a real anxiety that we see a lot of patients having as well.